Being a psych nurse has opened up so many different opportunities for me. And I probably wouldn't be here today in this position if I didn't start off in psych as a new grad RN. And fortunately enough, I was able to go that route and I was able to work in different settings as a psych nurse. So I have a good perspective on what I feel like are the top settings for people that want to get into psych, whether it's to stay in psych, switching from a different specialty, or they want to become a Psych NP. So in this video, I'm going to be going over my top 5 settings to work in as a psych RN. So stay tuned. Welcome back to the channel, LifeofaPsychNP. If you are new to this channel, let me formally introduce myself. I'm Darty, I'm a Psych NP, and in this channel I go over several different topics related to mental health, nurse practitioners, and specifically psychiatric nurse practitioners like myself. And if you are interested in any of these topics, feel free to subscribe, make sure you like the video, and follow me on Instagram at LifeofaPsychNP. So, you probably clicked this video because you're interested in finding out what the top 5 settings are to work in as a psych nurse, whether you're switching from a different specialty, or you're about to become a new grad RN, or you want to get into psych to become a Psych NP. This video is for you because this is something that not many people talk about, and having worked in so many different settings as a Psych RN and a Psych NP, I was able to kind of see which ones are going to be best for psych nurses. So you have to take in consideration whether it's going to give you enough experience to become a Psych NP, or if it's going to give you the best work-life balance, or it's going to give you that different change in understanding how people's behaviors are. This video is going to go into detail in all of those things, especially with each setting alone. So it's going to be a great video, so make sure you stay until the very end to find out about my top experience as a psych RN that's going to be able to set you up for success, whether it's you want to stay as a psych RN, or you want to be able to become a Psych NP, or if you just want to learn about different things that are going to set you up for success with learning behaviors and certain traits, then you want to stay till that very end thing. So without further ado, let's go over my top 5 settings to work in as a psych RN. So let's go. So the first setting that you should work in as a psych nurse is inpatient psych. Whether you want to become an LPT, if you're an LVN, you're a psych RN, or even a Psych NP, this is a great unit to work in. And the reason being is because you get to see severe behaviors. You get to be able to see patients actively psychotic, actively manic, and actively suicidal. All of these things all wrapped in one, and this is where you want to be able to see them, and you're going to be able to see them. And yes, obviously there are certain instances, especially if you're in this situation where there are aggressive behaviors, there are people that do go off, so it can be a dangerous setting, but at the same time, it's not like it happens all the time. Yes, it can happen in your shift maybe 3 or 4 times a week, depending on how many times you work, but it can happen, and it's a matter of being able to rely on each team member to make sure you're safe. But then that's beside the point. But the reason why I say this is on my top 5 list is because you get to learn so much. You get to be able to see what psychiatrists prescribe, or you get to be able to see what Psych NPs or Psych PAs are able to prescribe, and understand how it impacts based off of their symptoms. And you get to see how severe they are, and then how they're being able to get adequate resources, whether it's from therapy, whether it's from medications, or maybe emergency injections, or certain things that will happen in order for them to get better. And you get to be able to see that from going from very, very, very acute to now being able to stable enough to be able to be discharged. And this is a great opportunity, whether you are going to be a LVN, or you are going to be a LPT, or whether you are going to be a Psych RN, or you're a Psych NP wanting to work inpatient. I think this is definitely top 5, because at the end of the day, this is where you're going to be able to, 1, learn behaviors, 2, it's going to be able to give you a sense of how to be able to see what behaviors are, how to act, and be able to see how medications are utilized appropriately in order for them to go from highly acute to being able to stable enough to be able to discharge into the community. So definitely think about this, especially if you want to work in psych. So the second setting on my list is working in a crisis stabilization or psychiatric urgent care. And the reason why this is on my top 5 list is because in this unit you get to do pretty much everything. And depending on where you work and what facility you work in, a lot of the times they're gonna have back units where you have to do the crisis, where they maybe are actively psychotic, suicidal, actively manic, in those different phases where they are on hold or they might be coming in voluntarily, and that's where they do the assessment. And a lot of times they'll have that front unit where people can walk in, whether it's to get a refill, to be evaluated, to be assessed, or get resources. So you kind of get best of both worlds in the mix of being inpatient versus outpatient. And this is a great opportunity, especially if you're LVN, if you're an RN and wanting to become a Psych NP, because you're able to see both sides of things. Not a lot of people do get to see that, and when you're an inpatient, you're kind of stuck in that little bubble of just understanding how inpatient works and just learning about crisis and learning about that stabilization, but you don't necessarily see the meds that can actually help in the outpatient setting that you might be able to see here. And this is a great opportunity because you get that mix, right? And I'm not saying that inpatient is better, or the crisis stabilization, or the crisis stabilization or the urgent care is better than inpatient. All I'm saying is you get to be able to experience both sides of these things, and this is a great opportunity because it helps with understanding and gaining that knowledge, especially if you want to be a Psych NP, because you get to see both sides. And when Psych NPs work there or psychiatrists work there, you get to see different styles and understanding, okay, this is how they do it in this side of things, in the inpatient side, versus this is how they do it in the urgent care side of things. So it's definitely a beautiful mix. So the third setting on my list is working in an outpatient community mental health center, and this is a great opportunity for nurses. Although there are not that many jobs available, especially for LVNs and RNs working in this type of settings, but there are opportunities to be able to do so. And when you have that opportunity, it's great because you get to see so much. And a lot of the times, depending on where you're working, you're going to be utilized as someone that's going to be able to give the injections, be able to kind of look at their chart, do vital signs, do assessments for other practitioners or other psychiatrists that are going to be able to put into the situation. So it's going to be a great opportunity overall. And the reason why this is top on my list is because these jobs are very few, but you can learn so much, and it gives you that work-life balance, especially as a Psych RN or a Psych LVN, LPT, because it's going to be able to allow you to do that while still learning and not necessarily having to grind on that acute side of things, and still be safe enough because you're dealing with certain types of behaviors, but not as acute compared to crisis stabilization or inpatient. And also the good thing about it is you get to see all of these patients, because a lot of the times if they're in that community mental health center setting, they're more acute compared to like those private practices. So you get to be able to see combination of meds, and then you be able to talk to them and see how you can learn about their different behaviors and how different disorders will impact exactly how they're doing. So you get to see all of those things, and you still get to be able to have that cush Monday through Friday job and doing all of those things. So it definitely offers you knowledge, but also be able to offer you that work-life balance as well. So the fourth setting on my list is working in Psych ER. And I think working in acute settings is going to be extremely important, because you're going to be able to distinguish what's really bad versus what's normal. And once you start to understand what's really bad, and you'll be able to kind of see and pinpoint different things that are a little bit more difficult to handle or difficult to kind of look at, because you'll understand like, okay, certain delusions or certain things that this patient might have that you feel might be normal to someone else, you're able to kind of pinpoint, because you're able to see like, okay, this is what the patient's exhibiting, this is what you're kind of observing based on the patients, how they're acting and how they're present to you, and you're going to be able to kind of pinpoint that. And a beautiful thing about the Psych ER is these patients are very acute, and there's a reason why they're there. Similar to that crisis stabilization, depending on which psych ER you work in, is whether they're going to come in on hold or if they're not even on a hold and they want to be assessed to be able to be put on hold. This is kind of the case, and in psych ERs you get to be able to see severe behaviors, and this is a good thing because once you start to learn and see these severe behaviors, it's going to definitely set you up for success depending on where you want to go. Good thing about being in psych ER, a lot of the times they go off of that ER schedule, so you're going to be working 12-hour shifts, so you can be working 3 days and then you still have that work-life balance to be able to do other things. But mind you that a lot of the times, because it is the psych ER, a lot of those behaviors and a lot of those things are definitely intensified. So if they're aggressive, irritable, agitated, there's a good chance that there's potentially going to be codes where you have to give emergency injections, or if you're fortunate enough to have restraint beds to be able to put patients in restraint, to be able to make sure the whole community and yourself and the nurses and the staff are safe. So this is a definitely good opportunity because you get to understand how to treat patients that are very, very, very acute and being able to kind of handle that situation. So moving forward, even if you become a Psych NP or you go into outpatient setting, you're going to be able to understand like, okay, this is how things are done in this setting, and let's figure out how to do things in the outpatient setting, and then just round yourself out overall. So the fifth and my top setting to work in as a psych nurse is being a remote behavioral nurse. And the reason why this is the top of my list is because it gives you best of both worlds. It gives you the knowledge to be able to be a great psych nurse, but also gives you the flexibility of working at home. And there's different types of behavioral nurses out there, especially when it comes to remote positions. There are people that are behavioral case managers, there are people that are just remote psych RNs, and there are situations where you are that line where people call when they are in times of crisis or emotional distress, and you're going to be able to decipher whether they need to go to the ER or to be able to call the CAT team, or which is like the crisis team or the psychiatric evaluation team, or whatever the situation is, to be able to make sure they can get the services. And this is a great opportunity. One, you get to work from home, and then two, you're going to be able to understand and learn different things, whether it's being able to assess them and doing the assessment from the very beginning to relay the message to the psychiatrist, Psych NP or Psych PA, to be able to do a thorough assessment as well. Or you get to be able to talk to them, especially when they're in crisis, to be able to decipher and assess and judge whether they need to get emergency services or they're okay to be able to contract for safety, to be able to just follow up with their normal provider or give them those resources. And sometimes case management, it's all right. And sometimes, depending on what you do, it may be helpful, especially when you're working on different ways to get them the resources available. But it's not necessarily as much patient care compared to the other types of remote behavioral nurse positions. And the good thing about this is there's so many different opportunities out there, especially if you just do your normal remote behavioral health search. You might see like, oh, crisis line, or doing the assessments, or UR, or being able to do case management, or whatever it is. But the good thing about it is it's out there, right? And like I said, this is a great opportunity in the top 5 on my settings list because it gives you best of both worlds. If you're wanting to get experience and be able to learn about patients, learn about behavioral health, you get to be able to do that remotely, have that lifestyle because you get to work remotely. And if you are in school also, this is where it helps too, because you get to be able to study and learn while working. So everything is definitely good here, and some people might disagree. And at the end of the day, I'm not here to kind of say which one is better than the other, but I just think if I were in a situation, especially with being in a different unit, I'm transferring to psych and wanting to go back to NP school, why not go in this role and be able to get psych experience, be able to understand and learn by talking to real patients, and still having that flexibility not to have to go to the hospital And especially if you want to keep your family safe, especially you don't want to be able to be in a situation where it's dangerous, then this is a great opportunity. And if you need more time to be able to study or even take online classes, you can do so because you're remote. And this is the beauty of being a remote behavioral health nurse. So definitely think about it. Well guys, I hope you enjoyed this video. I hope I was able to give you different opportunities to learn about different types of nursing out there, especially as a psych nurse. And definitely any one of these opportunities or any one of these settings will be great to set you up for success to become a psych nurse, and especially if you want to be a Psych NP. So definitely look at all of these resources, do your due diligence in researching the opportunities around you, and if you find any of these things, definitely feel free just to work in it, because once you get experience in one of these psych nursing areas, it's a lot easier for you to get experience in another psych nursing area as opposed to coming in brand new. So think about it. Well guys, I hope you enjoyed the video, and until next time, bye!